So this is like a hard and different video to make. I'm sure the title has given away the conclusion already, but I need to sit down and for my own self, I want to share my story here because maybe it brings me some comfort or maybe it's something to look back on. And maybe for those of you who might be going through a similar thing, I know I personally find comfort in following these stories and other women right now. So maybe someone out there can find some solace or something in me sharing mine. Anyways, intro. My name is Sarah, for those of you who may have stumbled on to my very small corner of YouTube. My name is Sarah. I am a knitter, spinner, crafter, fiber artist. I am a 35-year-old mother of 3, and I found out that I have breast cancer last month. So I'm going to knit while I talk in order to hopefully distract enough of my brain that I can get through my story to this point without too much waterworks, because I am a crier, but I don't need to share that with the whole world. So we're going to try and keep it casual, and I just want my story out there and my record out there, and I want to look back at this one day from the other side and see where we've come. Like I said, I'm 35 years old. I turned 35 in February. I'm a healthy non-smoker, not really too much of a drinker, non-drug user, non-anything. I'm a runner, and I've stayed basically in what the medical profession would say is, healthy body condition my whole life. I haven't had really a unique or interesting medical history myself, apart from some kidney stones. And I know that I don't have a cancer gene because I actually had my genome sequenced completely when we were looking into some medical issues in my kids. So I shouldn't have cancer, right? But unfortunately I do. And this is how we found out. So on Saturday, March 11th, I had some breast pain in my right breast. This was unique for me because I've never been one to have breast pain, which can be common as your cycle fluctuates, your hormone cycle. The only other time I've had breast pain in my life was having mastitis when I was breastfeeding our son Marshall, and this certainly wasn't that. It wasn't crippling or crazy painful, it was just different. And the breast pain was associated with some lumps in my breast. Now, those lumps have been there for a very long time, and at my physical with my family physician this year and the year prior, and my husband's a physician, and the sort of general consensus is I have fibrous lumpy breasts, which are very common in younger women. The breasts don't feel or the lumps don't feel concerning. They certainly don't feel like cancer, and that's sort of been the story that I've also believed about myself. I'm the first person to say, oh, well, I've always had lumpy fibrous breasts. But I'd never had breast pain before. Now, we weren't thinking cancer. We were thinking maybe there was some residual infection in there from mastitis the year prior. Sometimes those things can get sealed up by your body and sort of get angry again later. Maybe it was a large cyst that had somehow formed that might be needing draining. So that Tuesday, I went and saw my family doctor about it. She again did a breast exam, and the lumps on top, no, those feel like fibrous breast lumps, but I do feel a cluster of cysts around the side. We'll book a mammogram and ultrasound, and she sent me there believing that maybe they'd find a cyst big enough that they might drain that cyst that day. This is not a complaint against my doctor. She is an excellent doctor, and that, when you hear hoofs, you look for horses, not zebras. And in a 35-year-old woman with no family history of breast cancer, you look for horses. So I went to my mammogram thinking, well, this is welcome to being a bit older. I get to hop on the mammogram cycle a little sooner than you otherwise would. Here in Alberta, in Canada, which I guess I should have said, we're in Canada. They don't start routine breast cancer screening until 45 is when they'll outreach screen you. 40 is when you can sort of request it and be welcomed into a screening program. So 40, 45 is the usual starting age for mammogram. And here I was feeling special and old that I got to start early at 35. I got to the mammogram clinic on Wednesday, March 15th. I had the mammogram first and then the ultrasound. Prepared for the mammogram, and the technician said, because of your young age, normally we do 2 different views on a mammogram, but because of your young age and to lower your radiation exposure, we'll just do 1. So we did my 1 view on the mammogram, and then I had a couple of hours to kill before the ultrasound was scheduled that day. I went and bought some fiber arts goodies at some thrift stores, and came back to the clinic, still not phased, and had the ultrasound. Now, I've had a large number of ultrasounds in my life. I was pregnant with twins, and so those came with ultrasounds that were at some points during the pregnancy every week. And I've had a history of kidney stones, so that tends to come with a lot of screening ultrasounds. I also, during my grad school days, performed ultrasounds on rodents, so I'm certainly not an expert, but I would say that I always watch the screen and I can kind of tell sometimes when things aren't what they seem. The ultrasound technician was lovely and chatty, and I watched as she measured under the bottom side of my breast a lot of little cysts, which are very clear on ultrasound, empty black circles. And she continued to be chatty, and we just measure everything, whether it's good or bad. And then she stopped being chatty. And she started measuring things that were very clearly, to me, not cysts. Things that on Doppler, on the ultrasound, very clearly had blood flow. Things that, as I nervously Googled in the waiting room after, looked an awful lot like they could be cancer. And they didn't send me home. Instead, they said that the radiologist wanted to just go ahead and get those other views on the mammogram. So I got the other views on the mammogram. And then the radiologist wanted to talk to me. And normally at radiology clinics that do ultrasounds and mammograms and x-rays, you don't see that radiologist. He works, or she works in the back and sends their reports and does not talk to patients. So you can imagine emotions. My fear when he came out to tell me that you'll be needing a biopsy, but your lymph nodes look clear at least. So it was a lot of emotions that I drove home from that appointment. I wish I had known that that's how that day would go out. I would have brought my husband with me. As it was a very isolating and terrifying and lonely experience, as sort of the nerves built as it became clear that it was not going to be just a cyst or just a fibrous breast lump. So that was on Wednesday, March 15th. And I knew that the radiologist had said, you'll be needing to have a biopsy. And we went ahead and booked one for the following Monday. But I wanted to know exactly what was on that radiology report. Like I said, my husband's a physician, and he indicated that radiology reports, when the radiologist says it looks like cancer, his experience is that it's cancer. So I called my doctor, and she was happy to oblige and send me the radiology report directly. And my findings were labeled with a BI-RADS 4C. BI-RADS are a score, a standardized sort of scoring that radiologists use to rank the likelihood of cancer. BI-RADS 1 is that it was a completely normal mammogram ultrasound, nothing concerning, nothing found, just completely normal. BI-RADS 2 is we found something like maybe a cyst, but we have no suspicion at all that it's cancer. Level 3 is, I believe, like less than 2% chance that it's cancer. Now, BI-RADS 3 doesn't typically get put down because it leaves the patient in a gray area of, do you proceed with further screening or do you not? And so often things get bumped into category 4. Because things get bumped into category 4, it's been further subdivided into an A, B, and C. 4A is greater than 2%, but less than or equal than 10% chance that it's cancer. 4B is 10 to 50% chance that it's cancer. And 4C is between 50 and 95. BI-RADS 5 is that we are 95 or greater percent certain that it's cancer. And I believe there is a level 6. Level 6 is that we already knew it was cancer, and this is just a confirmational mammogram. So maybe you've had cancer in the past and that they know that tumor is still there. So mine was labeled BI-RADS 4C. So the radiologist was between 50 and 95% certain that what he was seeing was cancer. And weirdly, we took not comfort in that. I mean, obviously you take comfort in, no, it's not cancer at all, but it allowed us to mentally sort of prepare for what would be coming next. We sort of put ourselves in a, okay, this is cancer. Like, the radiologist is more than 50% certain that it's cancer. So we didn't hold on to hope for a false interpretation of my radiology results. We mentally began to start processing and dealing with that this is cancer. And to hold on to the fact that they imaged your lymph nodes on that ultrasound and in the mammogram, and so far the lymph nodes look clear. So the following Monday, that would be March 20th now, I went and had a biopsy. The biopsy is done by a radiologist at an ultrasound clinic, so they will guide a biopsy needle with the ultrasound. This is a very common way to biopsy for cancer. I think that it's possible to do sort of an unguided punch biopsy, but not common is my understanding. And I don't think it's likely that they'll jump right to a surgical biopsy where they have to like properly cut you open and remove something. So the most common, I think, way of the next step is a needle guide or an ultrasound guided needle biopsy, which is what I had. Just done under a local anesthetic. They freeze the area, make a small incision, and then guide a needle right up to your tumor. It's not a skinny needle. It's sort of a big device. It's a hollow cord needle that basically, once they get the core of that needle up against the tumor, they trigger it and the center comes out, grabs a piece, and yanks it back into the hollow core of the needle. The local anesthetic freezing was very effective, but when they clicked that trigger, man, you could feel an impact and a yank. But I mean, you're not going to, I mean, I certainly am not going to complain or stop a procedure. As far as I'm concerned, they could biopsy as many times as they needed to get the best, most clear picture of what's going on inside of me. They took 4 different samples, 2 from one site and 2 from a separate site, and sent those off for pathology. So that was on Monday. The clinic where I had the biopsy done says expect at least a week. My own family doctor said usually it's 2 to 3 days. And so we waited until Friday, which is when we got the final results of the biopsy from my doctor. So this is Friday, March 24th now. And those results confirming that both sites that they sampled in my breast were cancerous. One of the sites that they sampled was what's called a ductal carcinoma in situ. So the most common breast cancers form inside the milk ducts, and ductal carcinoma, so cancer in your milk duct, in situ, meaning that it's staying in place still, so hasn't tried to escape the duct. So looks like I have potentially a couple of sites in my breast that are the in situ variety, which is the you caught it super early. And I have one site, the other location, that is a ductal carcinoma that was malignant. Okay, so editing Sarah here. When I recorded this, I misspoke. It's not ductal carcinoma that's malignant. The correct terminology is invasive ductal carcinoma. Just wanted to clarify that. Malignancy can have a variety of connotations with cancer. So to be specific, an invasive ductal carcinoma, which means that it's showing signs that the cancer is wanting to escape or has evaded the duct, which is more worrisome, obviously. And so that was Friday, and confirmation that it did in fact have cancer, and a referral is now being sent off to the breast cancer the breast health clinic in Calgary to a cancer surgeon, since most, not all, but most breast cancer is surgical. Um, and also, we ordered right away in order to speed up the staging, right? So, from the pathology, they know what this cancer looks like, but they can't know definitively whether there's cancer in places that they haven't sampled, right? So, we referral to the surgeon and a referral for a CT scan to look for obvious cancer spread outside my breast. I had that CT on March 30th. They did it with contrast and head to toe, not head to toe, it was sort of like the bottom of your pelvis to your neck. And luckily, that came back with no additional signs of cancer, no gross, obvious signs of cancer anywhere else, which we're super grateful and thankful for, obviously. Then we waited and waited. It's crazy because my doctor and everyone who talks about cancer diagnosis says once you have that diagnosis, things move really quick. And when you step back and you look at the perspective on the Canadian healthcare system, which pros and cons, but I will take my Canadian healthcare system every day. Um, if you have nothing urgent, for instance, when I knew I had a kidney stone but hadn't passed it yet, that referral to a specialist was months. And in fact, the kidney stone became urgent before I ever saw that specialist. So, in comparison to the sort of usual timeline of months, if not years, to see surgeons about things, this has been very fast. From the inside perspective of feeling cancer crawling inside your skin, not that you actually can, but that's where your brain goes, trust me. It felt like the following week crawled until we finally got the call that we would have an appointment with the cancer surgeon on April 12th. That was also a Friday. It seems like a lot of my news is coming on Fridays. In that time, we had mentally sort of put ourselves in a brain space of, I'm very comfortable to lose this breast. I'd rather err on the side of more surgery to have less risk down the road. So in our minds, we were thinking they're sending us to the surgeon right away. Maybe the surgeon will book a date, we'll take the breast off, maybe a little radiation, like this, like that. 6 months from now, we're celebrating cancer-free. So the appointment with the breast cancer surgeon was a letdown. In addition to the regular pathology, breast cancer is well studied, and breast cancer can have 3 different receptors on the cancer cells that determine the growth or drive the growth of cancer. So you may hear terms like ER, estrogen receptor positive breast cancer, PR, progesterone receptor positive breast cancer, or HER2, and that's like a human epithelial growth factor breast cancer. You can be positive for any one of them, you could be positive for multiple, or you could be triple negative. Because it's well understood how those pathways work, chemotherapies can be targeted to your cancer depending on what you express. And my cancer is estrogen and progesterone negative, so they're not being driven by female sex hormones, which bodes well because if you're estrogen or progesterone driven, that often may entail, especially for a premenopausal woman, sometimes you have to be on estrogen suppression for the rest of your life to minimize risk, right? Gratefully, I'm not triple negative. If you're triple negative, it does greatly limit the treatment pathways that are available to you, although research is every day moving things forward. I saw recently that there was a new drug approved in Alberta for triple negative breast cancer. Luckily, mine is at least one positive. It's Her2 positive breast cancer. So what that means is that although it can be a fast-growing cancer, it is very susceptible, or should be very susceptible, to targeted chemotherapies at that Her2 pathway, which means that it's best practice to do chemotherapy intensely before surgery, and then likely more chemotherapy after. The reasoning behind that is that although they scan your body and don't see signs of cancer, individual small cells may have migrated, and a cluster of 10 or 20 or 100 cells may not show up on any kind of imaging that we can do, right? So while you have a large tumor in the breast that you can watch for response to your chemotherapy, treat with chemotherapy. If that breast tumor shrinks, then you can extrapolate that the cells that may have escaped elsewhere in your body will also shrink. And I'm really not interested, to the best of my ability, in having surprise cancer again later, right? So chemotherapy before surgery is going to be the right choice. We haven't seen the oncologist, sorry. We've just seen the cancer surgeon. We'll see the medical oncologist who'll be in charge of the chemotherapy portion of my treatment next week and find out exactly what combination of drugs, how many rounds of chemo, etc. But from my surgeon's perspective on the number of cases that he's seen in my type of cancer, it's often 6 rounds of a global, more aggressive chemotherapy that will likely last over the course of the full summer. He suspects we'll be looking at surgery in the fall, and that likely there'll be a year of sort of a lighter chemotherapy afterwards. And that was a letdown because, man, we were really hoping, Kevin and I were already talking about Mexico or Italy or something in the fall to come out the other side of this. But, you get what you get. So that's where we are today. I got a call today that they're going to schedule me to have a chip tracer inserted into the center of where my tumors are. And that would be a simple ultrasound guided needle procedure to just put a little marker in there in case, fingers crossed, the whole tumor. The surgeon was unclear as to whether it's a cluster of distinct tumors or it's more like one tumorous area with specific clusters in it. But they're going to put a little tracer into the center of that so that in the hopefully chance that the chemotherapy is incredibly effective and it shrinks and kills all signs of cancer from my breast, that little marker will let the surgeons know later what does still need to be removed, because it's still, like I said, better to opt on the side of get as much tissue out that could still be cancerous as possible, whether you can see it or not, right? So I'll have that procedure coming up. We'll see oncology next week, and I assume that chemotherapy shouldn't lag too far behind seeing oncology. I have a bone scan next week as well to, on the CT, they'll be able to see sort of lytic, like very obvious metastases into your bones, and we didn't see any of that. The bone scan will now look for sort of areas of increased metabolic activity in your bones. And so fingers crossed on that one, because so far everything has said that we've caught this while it's still in the breast. And I would really, I would really like for that to stay the case. So that's the story. That's where we are. And yeah, I needed to share this because, when you're 35, you're invincible, right? Oh, fuck, emotions. I haven't knit anything. I said I was gonna knit and I haven't knit anything. When you're 35, you're invincible. Like, certainly not as invincible as you were in your 20s, but your cancer's not on your radar, not unless you have a very specific reason for it to be. And when you look into what's available online, a lot of breast cancer stories are in older women. A lot of breast cancer stories are not in young mothers. And so, yeah, maybe somebody somewhere out there sees this and takes some comfort or something from it. And maybe it's important to me that I document this journey here. As far as my YouTube goes, it's certainly important to me to get this out there because, this year I kind of decided to take a swing on me, ironic, and really push to try and build my YouTube channel a bit and see what I can make out of my interest in my fiber arts world. My kids are getting a bit older. Marshall's still only 2, so it's not that old, but my kids are getting to a point where I can put a little bit more into me turns out we're going to be putting it into me for a totally different reason. But, you know, I was building momentum and getting into the swing of regular videos and updates and had all kinds of ideas and projects. And I was going to spin 23 yarns this year and share them all with you. And the cancer diagnosis felt like a big elephant in the room, because I want to keep producing some of that for as long as I am able to, and for afterwards. It brings me a lot of joy to share the things that I enjoy with people who also enjoy it. Um, but how do you make a video saying that you're still going to do 23 yarns this year when clearly you're probably not, right? Like, let's not kid ourselves. As targeted as chemotherapy might be, and as far as things have come, it's going to suck. It's not going to be a fun summer. So it felt like an elephant in the room, and I've sort of been waiting. I would like to have known a little bit more about what I was looking at before I talked to people, and it feels good right now to be getting this off my chest and into my camera. So I'm going to try and give you as much, but really give me as much normal here as I can. I definitely, and I've said this to my family members and to the people I care about, I want as much normalcy as I can through this. I don't just want to be a cancer person for the next year, plus who knows of my life. For mental health, and fiber arts are great for mental health. I need as much of the things that I enjoy in my life. And so I needed to pull the band-aid off and sort of share the things that I don't enjoy, the cancer diagnosis, right? So there's that. What I did want to say, we're incredibly lucky. There is no call for funds. There's no Kickstarter campaign. There's nothing. We are so incredibly lucky to live in Alberta and in Canada, and to have the financial security provided by my husband's career, and to have me not have to worry about job security, being predominantly a stay-at-home mom. I mean, I manage my husband's clinic, but that's tasks that can be passed over back onto him when I'm unable to. So we're lucky. I don't need any financial help from anyone. I'm incredibly grateful to live in a country that a cancer diagnosis is just a cancer diagnosis and not a financial diagnosis for your family. And I am acutely aware of how surprise medical news in places in the world, and in particular my American viewers, how, you know, medical news like this can be financially devastating as well, and how lucky we are to not have to bear that burden. Um, I mean, they'll cover reconstructive surgery here, so incredibly lucky. So that's not support that I'm looking for or asking for. If you feel inclined or you want to give a monetary something, it's not to me. I've put a link in the bottom to a resource from the breast cancer organization in the States, that lists a number of charities that are aimed at providing financial aid to people who might need it as they go through their breast cancer journey. Click that link. There's a whole list of charities there. I mean, breast cancer is a well-funded cancer, right? It's not a cancer that people sweep under the rug. So I think, you know, as opposed to money towards research, which I mean is also important, money towards people who are going to be devastated by this diagnosis in more ways than just what I am, is the better choice. The other thing that I wanted to say is take care of your breasts. Here in Alberta, in Canada, screening mammogram used to not start until 50. It's only in the last year or so that they've dropped that down to 45 for outreach screening programs to start, and 40 if you're keen to start earlier. But 1 in 8 women in their lifetime will be diagnosed with breast cancer, and statistics vary, but between 5 and 10% of those women will be under 40. They'll be before screening campaigns, before routine screening mammograms are available to you. So you have to know your breasts, you have to feel them, and I mean, for over a year, I was content with this mindset that I had a lumpy, fibrous breast and it wasn't cancer. And it was. And not through my own fault, and not through my doctor's fault, not through my husband's fault, not through anyone's fault. Because it doesn't feel like cancer. Even the doctor doing the biopsy said it doesn't feel like cancer. Um, but as soon as I felt a little bit of pain, that was different, that was new, and we found this. As opposed to doing the mom thing where you take an Advil and ignore the pain and then it fades away, and then, you know, 2 years down the road when you've got metastases everywhere is when you find out. So know your breasts and advocate for yourself. I don't know what the situation is like in the US, but I do know that if you're lucky enough to have a family doctor here in Canada, and I mean, that's, you know, there are pros and cons to our health system, and the number of Canadians who don't unfortunately have a family doctor is a con. Um, if you feel something different, if you feel something is wrong in your breasts, push for that mammogram. I mean, they do a cost benefit analysis on these things, and the cost is that you may unnecessarily be subjected to a biopsy. There are worse things in the world. So if you feel strongly, advocate for yourself and get that mammogram and that ultrasound. Because it's super common, and apparently cancer rates are going up for breast cancer diagnoses. So know your breasts, you know, self-examine, be aware of any changes, because it's not impossible in your 30s or in your 20s. And breast cancer is definitely a cancer of the sooner it's found, the better your outcomes are. So yeah, that's what I got. Whew. Yeah, hopefully I or you or someone find something in this video, and at the very least, the elephant's out of the room now. I should say that I do plan on bringing my blog, yarnlab.ca, to resurrect it and to start writing a little bit about my experiences there. I do expect to have occasional specific to my cancer journey updates here. But I mean, my main goal in putting this out there, though, is to feel like I can put the fiber arts videos up there again. And, you know, if I'm not feeling a project, I can drop it and feel a little less guilty, because, heck, cancer's a hell of a thing. And yeah. Anyways, I don't know how to sign off. I have cancer video. Sorry if that seems nonchalant. There's a certain amount of disbelief humor that is also just operating inside of my brain. But yeah, that's all for now. There'll be more content. There'll be more yarny goodness. There'll be, I mean, we're still planning on planting my greenhouse this summer. Maybe I'll share that with you guys. But yeah, that's what I got. Cancer, which is like a terrible pun joke to end this video. I don't know how to do that.